Welcome to the Manitoba Fitness Council webinar. So happy that you were all on board with us tonight. Tonight we have a very special guest. We have Yannick Molgat-Seon, and he is going to guide us through a presentation. Just for a little bit of housekeeping, if you can keep your video off for today, that would be fantastic. If you can keep your microphone muted, that would be amazing. And we're going to allow questions, but we're going to put them in the chat just so that we have a chance to get through all of the information. And then we will pick up the questions at the end. Take it away, Yannick.
Thank you so much, Stephanie. I'm just going to share my screen here, so give me one quick moment. Okay, so hopefully everyone can see that. Am I good to go on your end? Awesome. Okay, so thanks so much for having me. I'm very enthusiastic about giving a talk to this group. I think that it'll be hopefully relevant to you and that you learn a bit of helpful information. I have shared my slides with Stephanie, and so if you're interested in having a copy, I'm sure she can forward them to you directly. Also, my email I've listed at the end of my talk, but feel free to contact me afterwards. Since we're such a large group, many of you may not be able to ask questions that you want answers to. Like I said, I'd be able to field questions offline pretty much anytime. So I've titled my talk, The Ins and Outs of Breathing During Exercise, and this is a topic that I'm obviously very passionate about. My area of research, my interests are specifically related to how we breathe when we exercise and how this is different for different people. Specifically, how this might differ between the sexes, how it might be affected by healthy aging, and how it might be affected in patients with chronic respiratory conditions. So the overarching goal for this session, and I acknowledge that this is a bit ambitious, is to examine the respiratory factors that affect our ability to exercise. And I'm going to do that by addressing what I think are three important questions. So the first question is, are the lungs built for exercise? It's not something we typically think about, but I'm going to try to convince you that the lungs are very good at what they do, and that exercise is actually relatively easy for them. Not always, but most of the time. So this will allow us to kind of look at an overview of how we breathe during exercise. Then I'll discuss something that's relatively new, and that's addressing how sex, so how males and females may breathe differently, specifically during exercise. And lastly, how healthy aging, since we're kind of an aging population, this is going to be a topic of increasing importance. But essentially, I'm going to try to answer how aging affects our ability to breathe during exercise. And obviously, breathing can become more difficult as we age. So as a bit of a background, the respiratory system is composed of a few main components. The first, obviously, are the lungs. They're there to allow for efficient oxygen and carbon dioxide transfer from the atmosphere to our blood and from the blood to the atmosphere. We have our airways, and their job is essentially to conduct air down from our upper airway down to those alveoli where gas exchange happens. We have a rib cage that kind of encases the lungs in the airways and protects them essentially. And it's also where the respiratory muscles are going to be anchored. So we have respiratory muscles in our necks, between our ribs, and obviously the diaphragm, which is sort of lining the bottom of the rib cage, that are all going to be connected to that rib cage and exert their force on them in order to drive airflow into and out of our lungs. Now, if you think of the main functions of the respiratory system, there's several, and I'm not going to talk about them all, but I'm doing one of them right now, which is communicating. But we also use our respiratory system for smell, and it's intimately involved in the immune response. So the ongoing COVID-19 pandemic should give you a sense of how that occurs. And finally, and this is where it's most important for exercise, is that our lungs are responsible for diffusion of oxygen into our blood from the atmosphere and carbon dioxide out of the blood into the atmosphere itself. So right now, as we're sitting here, our bodies are consuming oxygen, and we're using that oxygen inside of our cells to make ATP, which is sort of the units of energy that we use to fuel various cellular processes. And we produce carbon dioxide in turn. It's basically the opposite of plants. Now, obviously, providing enough oxygen to our tissues and clearing carbon dioxide requires that we move air into and out of our lungs. So we take breaths in and breaths out cyclically, and this allows for CO2 or carbon dioxide and oxygen to transfer efficiently between the blood and the atmosphere. And this is a process that's referred to as ventilation. Now, as you can imagine, when you start exercising, you breathe more, so you ventilate more in a sense. Exercise will essentially increase our need for oxygen. Our muscles, because they're working hard to push against whatever resistance we're pushing against or to move our bodies, will need more oxygen to make more ATP. And in turn, we'll produce more and more carbon dioxide. And we need to make sure that we can clear the carbon dioxide and provide enough oxygen to our tissues. And that means that we need to breathe more air. So if you look at the graph here on the right-hand side, I'll use a laser pointer here to make it a little bit more obvious what I'm referring to. On the vertical axis, we have ventilation, and this is usually measured in liters of air per minute. And then on the horizontal axis, we have how much oxygen our body is consuming. And you can imagine that this is basically analogous to the intensity of exercise. While we're sitting here at rest, we're only consuming a very small amount of oxygen, so we don't need to breathe very much. But if we were to exercise, say on a bike, at an increasing resistance, you'd see that our level of oxygen consumption would increase, and the amount of air that we're moving into and out of our lungs would also increase. Now, this is a deceivingly kind of simple process. It's actually a lot more complicated, as you'll find out during the talk. And it's really going to be central to understand this basic idea. So Cole's notes is that the more intense the exercise, the more we need to ventilate, or the more air we need to move into and out of our lungs. Now, in order to understand how our respiratory system responds to exercise, I want to introduce the concept of ventilatory demand and ventilatory capacity. And in order to introduce the concept in sort of a simpler way, I'm going to use an analogy. So if you think of the speedometer on your car, you'll notice that there's a certain speed going from 0 all the way up to, in certain cases, about 200 kilometers an hour. And the little dial that shows you how fast you're going at any moment in time, you can think of as how much demand you place on your automobile, or how much air you're breathing if we're thinking of the respiratory system. And this is determined by our metabolism. So the higher our metabolism, the more active our muscles are, for example, the more air we're going to need to breathe. The capacity of the respiratory system here in green is essentially the maximum amount of air that you can move into and out of your lungs. And if I come back to that speedometer analogy, it's basically the largest number that you have on the speedometer. Now, if you think of doing something like sitting down and stretching or doing yoga, this is something that's more metabolically active than, say, sitting at rest or sleeping. So you're going to have to move more air into and out of your lungs, but it's not going to be much. So you can see here that this would be equivalent to driving at a very, very slow speed. Now, if you were to start, say, running at quite a high speed on, say, a treadmill or running along the road, your metabolism would go up and you'd have to breathe a lot more air as a function of that. But you'll notice here that this dial here in blue, the ventilatory demand, only reaches about 50% of what the engine or what our respiratory system is capable of. And that's true for the vast majority of individuals. It's exceedingly rare that we reach the maximum level of breathing that our system is capable of. So in other words, the lungs are sort of overbuilt for the demands of exercise. Now, there's very rare circumstances where this may occur, but again, I can't emphasize enough that this is really not something that happens frequently in the average individual. So if we think of what determines ventilatory demand, it's our metabolism, it's how much air we need to move into and out of our lungs. It's something that we don't really think about too often. We're aware of it, but it's not something that we're consciously doing too often until it's really, really tough. And it's worth noting that the respiratory muscles are the ones that are going to be doing all this work. They're contracting rhythmically, exactly like our leg muscles or our arm muscles that we use to move. That work isn't free. They still need to get a lot of blood flow. They need the same nutrients as our muscles that we typically think of when we think of exercise. And if we were to imagine how much work these muscles are doing, you can sort of think of it as the work of breathing. And I'll talk about that term a little bit later. Now, obviously, the higher the intensity of exercise, the more air you need to breathe, the harder those respiratory muscles need to work. And they're not very big. So if I was to take everybody's respiratory muscles and put them on a scale, they might weigh about 1 kilo only. But they have to work really, really hard in certain circumstances. And particularly when the intensity of exercise is very high, breathing can be viewed as a form of exercise in and of itself. It's a muscle contracting doing work exactly like a biceps or a quadriceps or any other muscle that you're typically thinking of. Now, I'll give you a sense of how important this work is, this work of breathing. If you think of somebody on, say, a cycle ergometer or a bike, cycling at whatever the highest intensity they can achieve is, the respiratory muscles, if we measure how much oxygen they're consuming, they account for about 5 to 25% of the total oxygen that your body's consuming. So what that means is that that small, massive muscle is commanding a lot of energetic resources, if you will. Another way to think of this is that 95 to 75% of our oxygen uptake is everything else. So all of the muscles that we use for exercise. And it's easy to ignore this. The work that you need to breathe is sometimes very, very considerable. So ventilatory demand is how much air we're moving into and out of our lungs and how much work our respiratory muscles need to do. Ventilatory capacity is essentially the maximum capacity that our respiratory system has. And you can think of this in a few ways. So you can think of the size of the lungs. So in terms of the volume, the liters of air that your lungs can contain, they're much larger than you think, sometimes in excess of 3 to 4 liters each. You can think of the ability to generate airflow, so how fast you can move air into and out of your lungs, how much blood is flowing through the lungs. So remember that the air and blood interface in the lung is what allows for oxygen and carbon dioxide to transfer into and out of our bodies. And then the respiratory muscles, they have a certain inherent strength and endurance, exactly like any other muscle in our body. Now, you can measure ventilatory capacity relatively easily. So this is a photo of an individual who's undergoing pulmonary function testing at a hospital or in a laboratory. And they're going to be asked by, say, a respiratory therapist or a respiratory physician to perform a series of maneuvers that'll allow them to quantify exactly what the capacity of their respiratory system is. And this is going to be influenced by a lot of things. It's not the same in everybody. It's going to be influenced by things like age, which I'll talk about later. It'll be influenced by sex, again, which will come up later. And it'll be influenced by things like body size, so height and weight, as well as the exposure that somebody might have had to environmental pollutants. So think of forest fire smoke or secondhand smoke from smoking or occupational materials, for example. And lastly, of course, genetics. Some people are endowed with very large lungs, large airways, others not so much, and it varies. So again, thinking of exercising and how much we're breathing, the ventilatory demand that we impose on our respiratory system is essentially how active our metabolism is. The more intense the exercise, the more demand is placed on our respiratory system, the more we need to breathe. And then the capacity is what our pulmonary function is. If we're healthy, relatively young, large size, that would imply that our ventilatory capacity is quite large. So let's look at data from a group of Canadians. So this is data from the Canadian CAN-COLD study. So it's a study of obstructive lung disease. And if we look at just the healthy adults, so these are people from across the country that are above the age of 40, there's data for them exercising, going from rest all the way to max exercise. And there's also data for their pulmonary function. So we can get an idea with this data set of the relationship between ventilatory demand and ventilatory capacity. So at rest, as you're all doing now, I hope, some of you might be a little bit more active than others, our metabolism is relatively low, and the amount that we're breathing is relatively small. So think of something around 10 liters of air per minute. Now, in this setting, an average person might have a maximum ventilatory capacity. So this is the maximum amount of air that they can move into and out of their lungs in a minute. Might be about 120 liters a minute. It's a lot of air. And this is, again, in these adults about 40 years or older. So if we look at the relationship between ventilatory demand, 10 liters per minute, versus the capacity, 120 liters per minute, it's about less than 10%. So you can imagine that in this setting, you can breathe a lot more air if you need to, but since metabolism is low, you don't do that, right? Now let's take these same people and bring them up to maximal exercise. They're on a bike, we increase the resistance until they reach their physiological maximum. And under these conditions, their metabolism is increased considerably. Their legs are working really hard to push against the resistance of the bike. Ventilation is increasing. So in this case, ventilation might increase to about 65 liters a minute. So this is a lot more air moving into and out of the lungs. And their pulmonary function stays the same. So that means now that instead of a demand capacity relationship of 10 to 120, we're now looking at 65 to 120. So just a bit over 50%. Now, what you can take from this is that for most healthy adults, the lungs are overbuilt for exercise, and there's data right here to show that. If you needed to breathe more air, your lungs and your airways and your respiratory muscles can handle that. They can increase the amount of airflow in the lung up to about 120 liters a minute. So it's exactly like that speedometer analogy. Your car can technically, in theory, go 200 kilometers an hour. I hope you don't do that in Manitoba. You can imagine that the capacity of the respiratory system is usually much, much higher than the demand that we impose on it for most people. Now, since you're all involved in exercise to some extent and involved in training people, you might be wondering, well, what if I get fitter? Or what if one of my clients gets fitter? What happens to the demand capacity relationship there? Does the way that they breathe during exercise change? So let's look at an example. Again, this is real data of a 40-year-old who's healthy, sedentary, and they've undergone a maximal exercise test on a bike. And what I mean by this is that they're rigged up to a bunch of equipment that measures how much oxygen they consume, how much they're breathing, how high their heart rate gets. And they're asked to go from a very low intensity of exercise all the way up to the highest intensity that they can tolerate. And this happens usually over a period of 8 to 12 minutes. So in this case, their VO2 max, this is the measure of how much oxygen they can consume at the very highest intensity of exercise, is about 30 milliliters of oxygen per kilogram of body weight per minute. And this is about, close to the 50th percentile. So if you think of a bell curve, be right at the top of the bell curve. Now you can imagine that this measure represents a lot of things. It represents how well your lungs, your heart, your blood vessels, and your muscles work together while exercising at a really high intensity in order to ensure that you can achieve that level of exercise. So it's a really good integrative measure of overall cardiorespiratory fitness. Now imagine this person undergoes, they're really motivated. Let's say they want to do a marathon or a bike race, or they have some fitness goal. And they would want to become more active, and they do so, really intensely. They train intense aerobic training for about 5 years. Obviously, easier said than done, but they're cycling, they're running on a treadmill, they're jumping rope, etc. And they do this consistently for 5 years. So now they're 45 years of age. They're healthy. They're very active now, as opposed to sedentary, and they repeat that same test. Now their level of maximum oxygen consumption is 45 milliliters of oxygen for every kilogram of body weight for every minute. So this is an improvement by about 15 units. Now they're in the 95th percentile. They're considered incredibly fit. Now, this obviously means that something has changed in their body. Their physiology has changed. And we know that when you train this way, your heart changes, your blood vessel changes, so your heart gets bigger, it's able to pump more blood, your blood vessels get more numerous, your muscles get larger, and they have more mitochondria that can produce ATP using oxygen and producing CO2. But what's interesting is that the respiratory system doesn't change at all. So you can see that here. The capacity of the respiratory system doesn't change, the capacity of the cardiovascular system improves, the capacity of the muscles improves, and that kind of explains this improvement in cardiorespiratory fitness. And whenever I show this to people, they're kind of underwhelmed. They think, oh, geez, the lungs aren't getting any better as I'm exercising. My respiratory system isn't responding. And in some ways, it's not a bad thing. It just means that the lungs are overbuilt in the first place. So the fact that they're not adapting is just because they don't need to. They're capable of handling the load. So to give you a sense of how much more air somebody would be breathing while they're undergoing this level of training, I took the same graph as before. So this is somebody who's exercising incrementally up to their max as the intensity of exercise is increasing on a bike. And they're reaching about 67 liters a minute of minute ventilation. And then after training, the same person undergoes the same test, and now they're breathing almost 100 liters a minute. Even under these conditions, they can breathe more air if they need to. In other words, the lungs are not the weak link to their ability to exercise. It's still the heart and the blood vessels and the muscles. So really, when you think of exercise training, particularly in healthy adults, it increases the demand on the respiratory system, but not its capacity. But even under these situations, the lungs are still considered overbuilt. You can still breathe more air if you need to. So this is the first interim summary. I'll just kind of recap what we've gone over. So the main function of the respiratory system is gas exchange, moving oxygen from the atmosphere to our bodies and moving carbon dioxide from our bodies to the atmosphere. Now, exercise obviously requires a lot of gas exchange. We need to move a ton of air into and out of our lungs, depending on how intense we're exercising. Now, the demand imposed on our respiratory system is going to depend on a few things, but one of those things is going to be cardiorespiratory fitness. Those who are fitter will generate more of a demand on their respiratory system, but even under these conditions, the lungs, the airways, the respiratory muscles, the ribcage are able to respond to that increased demand. Now, the capacity of our respiratory systems is unfortunately relatively fixed. By the time you reach 20 to 30 years of age, your lungs are at their peak structurally and functionally, and it declines from there, but I'll talk about that a little bit later. Unfortunately, exercise training does not improve pulmonary function, at least based on the data that's available. But really, the silver lining here is that the respiratory system is overbuilt, even for the most intense exercise that you can imagine. Ventilatory capacity, so the maximum ability to move air into and out of our lungs, typically exceeds ventilatory demand by a considerable margin in the vast majority of individuals. So the next question that I kind of pose is, do these statements apply equally to everyone? And that's not an easy question to answer. There's a lot of things that are going to affect how we breathe during exercise, but I'm going to tackle a few of them going forward, specifically the influence of sex and the influence of aging. So before I get into the science, I thought I would provide a few anecdotes here that'll give you some context for the data that I'm going to present thereafter. So this is Roberta Gibb, or Bobby as she goes by. And this is a photo that was taken in 1966 at the end, so right at the finish line of the Boston Marathon. Now, Bobby Gibbs trained for 2 years in order to run the Boston Marathon. And when she applied to run, she received a letter from the race organizer saying that women were not physiologically capable of running marathon distances, which is, in my view, patently absurd and shocking, really. Now, at the time, the American Athletic Union didn't allow women to run races longer than 1.5 miles, which is roughly 2.5 kilometers. Again, a completely ridiculous idea. But in 1966, she clandestinely got to the start line, ran the race, and completed it unofficially. And she became the first woman to complete the Boston Marathon in a time of 3 hours, 21 minutes, and 40 seconds. For anyone in the audience who knows about marathon running or who's run marathons themselves, they'll obviously realize this is an incredible time, very, very fast. Now, despite the fact that there were many people watching her race and cheering her on, women were not able to participate until 1972, which is, again, ridiculous and really not that long ago when you think about it. Now, this isn't one anecdote, one example, but it's part of a broader theme. And so if you think of the Olympic Games, for example, Pierre de Coubertin, who's the sort of father of the modern Olympic Games in 1919, was quoted as saying that participation of women in the Olympics would be impractical, uninteresting, unaesthetic, and incorrect. I have a difficult time even reading that. Now, science obviously is part of our culture, and our culture influences how science is practiced. So if these things are happening culturally in sport, it's not surprising that it would be mirrored in things like human physiological research. So unfortunately, research involving humans has primarily been performed in males, and the sort of assumption has been that males are just slightly larger females, and that anything that's discovered in the male body is likely translatable to the female body. And again, that couldn't be further from the truth. Unfortunately, things have changed for the better. And here's data from the International Olympic Committee. It's taken far too long, but you can appreciate that on the vertical axis, we have the percentage of women participants in the Olympic Games. In black, there are the Winter Games, and in gray, the Summer Games. And we have time on the x-axis here, on the horizontal axis. And I've put this dotted line here because this is an approximation of the fraction of the world population that's female. And it's officially in 2020, or I guess 2021 in Tokyo, we've reached sort of gender or sex parity in the Olympic Games. So going forward, we should expect to see science that mirrors this sort of cultural trend, where inclusion of males and females is equal, and that there's no sex or gender bias. So if we come back to this idea of the respiratory system and how it responds to exercise, several important discoveries have been made over the past 2 decades. And these discoveries have sort of stemmed from the inclusion of females in basic physiological studies involving exercise and the assessment of pulmonary function. And we've noted, myself and many colleagues, both male and female, where we noticed that there's certain structural differences in the respiratory system that influence how we breathe when we exercise. Now, these structural differences are pretty much found in every single structure of the respiratory system. They're not massive, but they're enough to influence the ventilatory response to exercise. So let's start with the airways. Here you have two images. One is an image of a CT scan or a computed tomography scan of a healthy individual's airways. So basically this would involve taking an image of somebody's airways and then reconstructing the airway tree and making measurements of the size of the airways. There's a lot more airways than are shown here, but the resolution of the technique at that point in time wouldn't allow for the imaging of all of those very, very small airways without too much radiation. So if you do this in a group of males and a group of females, you'll notice, first of all, that they have different sized lungs. So if you match them for lung size, take a male and a female that have the same size lungs, for some reason, females have 14 to 35% smaller airways. It's the actual caliber of the airways. But it's most evident in the large airways. So think of the trachea, the first airway that runs down your neck and into your rib cage, and the bronchi, the two large airways that stem into each lung. What's interesting is that these differences are not present in before puberty. So in children that are from age 0 up to about age 12, the differences between the sexes are not there. But beyond puberty, that's when the differences manifest. We have absolutely no idea why these differences are there, but we have a rough idea of when they matter or how they matter, at least in the context of exercise. Now, if we think of the lungs or the ribcage and the lungs, here are some, again, computed tomography scans. These are taken from a group in Spain, a group of anatomists. And they looked at not just the size of the lungs and rib cages, but also their shape. And the astute observer here will notice that on the left-hand side here, the rib cages, in red is a representative female, and in blue is a representative male. And you'll notice that the shape of the rib cage is a little bit more sort of cylindrical or vertical in the case of the female rib cage, and it's a little bit more pyramidal or triangular in the case of the male rib cage. And since the lungs just grow to fill the negative space within the rib cage, those same shape differences are mirrored in the lungs. Now, on average, men tend to be larger than women, and so you'll note that, of course, there's size differences, but also these shape differences. Now, again, there's not a lot of clear evidence as to why these differences exist, but one theory is that pregnancy would result in an expansion of the rib cage that would make it more pyramidal in shape. And so if females had pyramidal geometry of their rib cages to begin with, it would stretch out the rib cage too much during pregnancy, which may be viewed as a negative thing. So again, this is only a theory. There's not a lot of evidence to support it, but it's been proposed. So those are some of the structural differences that have been identified, and the logical question becomes, okay, why do they even matter? And the short answer is that when you're breathing at rest or even at low levels of minute ventilation, there are absolutely no physiological differences that occur. It's only when males and females start exercising that we can start seeing some differences occur. And this is data from individuals in Winnipeg. And they range in age from about age 20 to about age 60. And they were asked to do one of these cycle exercise tests that I mentioned earlier. So going from a very low intensity of exercise up to a very high intensity of exercise, close to, if not up to, their max. So I'll orient you to the graphs here. They're in red, you have males, and in blue, you have females. On the left-hand side, there's individual lines for each participant. And on the left, or on the right, it's the average. So the vertical axis is that measure I was talking about earlier of the work that the respiratory muscles are doing. So how much work are the muscles like the diaphragm, the scalene, the sternocleidomastoid, the intercostal muscles, how much work are they doing during exercise? And then on the horizontal axis, you have how much air is being moved into and out of a person's lungs. You can appreciate that these are people that are exercising at quite a high intensity. And you'll also notice that the blue lines are above the red lines. So beyond a minute ventilation of about 50 liters a minute, the work that the respiratory muscles are doing is higher in females than males. Again, not exactly sure why, but it's likely related to these slightly smaller airways. If you think of breathing through a smaller tube versus a larger tube, it'll be much harder on the respiratory muscles to overcome the resistance of the tubing if the airways are smaller as opposed to larger. Now, if you think of the differences in the shape and size of the lung, that's going to influence the respiratory muscles directly because they're anchored to those rib cages, right? So you can imagine that the angle of the rib cage and its shape will influence how hard those respiratory muscles need to work in order to contract and expand the lungs themselves. So these are the three main respiratory muscles that we would typically investigate during these types of studies. And we can measure the electrical activity that's going on inside these muscles, which is essentially a measure of how hard they're working. So if we take one example here, the scalene, which is a muscle in the neck here, we can look at how active it is during exercise. That's this measure on the vertical axis here. And then we can look at how much somebody's breathing while they exercise. Again, this is the same idea where somebody's on a bike exercising from rest all the way up to their max. And you can appreciate that females have a higher activation of their scalene, but this is also true for the sternocleidomastoid and the diaphragm for any given level of ventilation. Now, the idea here is it's probably because their work of breathing is harder, so they need to activate those muscles to a greater extent. And whenever I show this data, one of the questions that always comes up is, well, does that mean it's more difficult for females to breathe during exercise? Is it possible that their respiratory muscles fatigue because of all this extra work? And the answer is no. And it's simply because females have superior respiratory muscles relative to males. And this is a study that was done in Vancouver that shows exactly that. So these are very fit cyclists, male and female, and the males are in black here, females are in the white squares. And on the horizontal axis, you have time. And on the vertical axis, we have a measure of the force capacity or the strength of the diaphragm. And you can see here that at baseline, they're at 100%. So the diaphragm is, at full strength. And then after a really intense bout of cycle exercise, so we're talking 85% of their max for as long as they can hold it. So this results in exercise times of about 10 to 20 minutes, depending on people's fitness. And you can appreciate that the loss of strength in the diaphragm is much, much higher in the males than it is in the females. So what this means is that male diaphragms are very prone to fatigue. Female diaphragms are very, very resistant to fatigue. So this is probably a compensatory mechanism to kind of overcome the extra work that I just described earlier. So second interim summary, the size and shape of the rib cage, the lungs, and the airways differ on the basis of sex. At rest, this doesn't really matter, but when we exercise, when airflow is increased through the lung, we see certain physiological differences in terms of how much work the respiratory muscles need to do, how much they're activated, and how likely they are to become fatigued. The outcome is the same. So there's no real differences in terms of what the sort of impact is overall. We just know that we get to the same endpoint, we just do it slightly differently. Now, again, a question that often comes up is what's the implication of all this esoteric data that you're telling us about? Well, we're working on it. It's still, this is work that's in its infancy. We're still trying to figure out what the physiological effects are. But in essence, we know that we can no longer assume that males and females breathe during exercise in the same way. Now, obviously, we're all slowly aging as time moves forward. So another question that you can ask is, what happens to our ability to breathe during exercise as we age? So that's the next question that we're going to address. So the respiratory system is like any other tissue in the body. It's not impervious to the effects of age, like our skin, like our blood vessels, like our heart, like our hair, etc. So how might aging affect our respiratory system? Well, let's take this example that I had earlier of a 45-year-old healthy individual who became very active after training. So again, their level of maximal oxygen consumption, that measure of how well their lungs, hearts, blood vessels, and muscles work together, is very high. So they have a tremendous level of cardiorespiratory fitness. Now let's imagine we put them in a time machine and they age 30 years. So now they're 75 years old, they're healthy, they've still maintained a very active lifestyle, but unfortunately, because of aging, the deterioration of all of our tissues, their level of maximum oxygen consumption has gone down. And this is a natural process that affects absolutely everyone. It's possible to slow that process down, but it's impossible to stop it from declining, unfortunately. Now, of course, this process of aging affects the heart, the blood vessels, the muscles, as well as the respiratory system. So we'll need to think about that idea of the demand-capacity relationship again, if you think of adding the effects of aging upon it. So the aging respiratory system basically will undergo a series of structural changes that are progressive, basically from age 20 to 30, all the way until the end of life. And this is shown very clearly with this graph here. And the structural changes that happen in the respiratory system, they're going to affect the function, pulmonary function of an individual, essentially changing their ventilatory capacity. So here on the horizontal axis, you have age. This is data from a very large multi-ethnic group of individuals who were involved in a study looking at the longitudinal effects of lung function. And you can see one measure of lung function is forced expiratory volume in 1 second. It's basically the amount of air that you can exhale from your lungs from being completely full to being as close to empty as you can get in 1 second. So here you can see that when we're very, very young, our FEV1 in this case, or our pulmonary function is very low. And then it increases progressively through growth and development, through puberty. Once we become adults, we reach a peak, and then it slowly declines progressively. And it's worth noting that this is a completely healthy, normal process. If you were to imagine somebody being exposed to environmental pollutants, smoking, etc., it would accelerate this decline, but it occurs in everybody. We're talking about healthy aging here. So if you think of the effects of aging on the respiratory system overall, it leads to a progressive decline in the ability to generate airflow, in the functional size of the lungs, so how much volume we can move into and out of our lungs voluntarily, how easy it is for oxygen and carbon dioxide to diffuse into and out of our bloodstream, as well as the strength of our respiratory muscles. So just like all the other muscles in our body, our respiratory muscles will lose strength as we age. So the Coles notes here is that aging reduces our ventilatory capacity. Again, thinking of that speedometer analogy, we're no longer able to go to 200 kilometers an hour. Let's say it's about 150. Okay? Now, the aging process is also going to affect how our respiratory systems respond to exercise by influencing the demand that we impose on it. So let's take two individuals here. They're cycling on a bike, and we're going to get them to cycle at the same exact intensity, so 80 watts. This would be a fairly moderate intensity for most individuals. Okay. Their ventilation, if you were to measure it, how much air they're moving into and out of their lungs, for an average 25-year-old would be about, say, 35 to 37 liters per minute. For the average 65-year-old adult, this would be higher, but 50 liters a minute. And again, this is due to the impact of aging on the respiratory system. So this means that aging, to some extent, increases the ventilatory demand of exercise. So it's getting a little complicated here, where there's a lot of things moving in different directions. So we'll try to kind of think of an example that's a little bit more applied. So from age 30 onwards, lung function declines progressively in healthy individuals, which reduces our ventilatory capacity. However, we also undergo a loss in cardiorespiratory fitness, as I mentioned earlier. So this reduces the ventilatory demand to some extent. So you have two graphs here, again, taken from a large group of individuals, split into male and female categories. These lines are essentially overlapping when you consider just the variability. And you can appreciate that our cardiorespiratory fitness declines with age, but so too does lung function. So you end up with a situation like this. When we're young, our ability to generate a ventilatory demand to exercise at a particular intensity is quite high, and our ventilatory capacity is quite high. With advancing age, our ability to reach those same intensities is lowered, of course, and so too is our capacity. But you'll notice that the demand is still lower than capacity. So this implies that even in older adults, the respiratory system is still capable of meeting the demands of exercise. It's still considered overbuilt. Now, another question might be, well, as we age, our physical activity levels change. Some people stay very active, some people less active. I've taken an extreme example because I like to exaggerate for effect, but this is Olga Kotelko, who was running track competitions well into her 90s and winning them. So are some people able to mitigate that decline in lung function with aging because they train, they engage in exercise regularly? Or is the effect of training still moot on the pulmonary system? This is a question, unfortunately, I don't have a clear answer for. Some of these studies are very, very difficult to perform, longitudinal studies of aging that account for all of the lifestyle factors that influence our health. But so far, like I said, there's not a ton of evidence that says that regular exercise minimizes the effect of aging on the pulmonary system. But I will acknowledge that high quality research is really lacking in this area. So if we think of longitudinal studies, which what I mean by that is studies that take groups of individuals and follow them for very long periods of time, as opposed to comparing two groups of individuals of different ages. There's two large studies that have addressed this that have completely conflicting results. So this group in Finland looked at the physical activity levels of adults as they age, and those with higher physical activity levels appeared to have slower declines in pulmonary function, which is really interesting. Conversely, a group in the US showed that masters athletes, so these are people that have maintained high levels of physical activity throughout their life, they actually had comparable levels of pulmonary function than their sedentary counterparts, meaning that they didn't gain any pulmonary benefit from exercise. So as a bit of an interim summary, the last one I'll provide before I finish up here is that aging causes a progressive decline in pulmonary function. And this is evidenced by our lower ventilatory capacity as we age. The age-related decline in pulmonary function is going to influence how we breathe when we exercise, and it increases our ventilatory demand. So that ventilatory capacity demand relationship gets a little different as we age. Regular physical activity is possible that it attenuates the effect of aging on pulmonary function, but I do emphasize that we need a lot more research to be sure of this. But I would contend that it certainly can't hurt. Staying physically active throughout your life will not worsen the decline in pulmonary function. At the very least, you'll derive a lot of health benefits from other health benefits from the exercise itself. So it's something we should encourage. Now, just to finish off, I've got only a few more slides here. I don't want to bombard you with a bunch of science and not give you some take-home messages. So one question you're probably asking yourself is, given all of what you've told us, how can we make it easier to breathe during exercise for everyone, really? In order to think of that, we need to sort of talk about the respiratory factors that affect our ability to exercise. So one that I addressed was the work of breathing. So how hard our respiratory muscles need to work in order to move air into and out of our lungs. We need to remember that these muscles, they're hungry. They need a lot of oxygen and they need nutrients to function. And so having a high work of breathing can make it harder to breathe during exercise. The respiratory muscles are exactly like our leg muscles or our arm muscles or any muscles we use to move. They're prone to being fatigued. We've all felt that fatiguing feeling after a really hard workout, and then the respiratory muscles are no different. So having respiratory muscle fatigue can make it harder to breathe when we exercise. Shortness of breath is something that we've probably all felt to some extent. It's sometimes referred to as dyspnea in the scientific literature. It's a completely normal feeling. It's sort of breathing-related discomfort or pain. And it happens when we exercise. If you're late for the bus and you try to run and catch it, you'll probably feel short of breath as you're doing that. Or if you go on a really hard run or a really hard bike ride, it's not uncommon to feel short of breath. For most people, it's a normal response. For others, it can be quite debilitating and difficult to handle and will lead people to avoid that type of exercise. The final one, and this is a little different here, is the idea of airflow limitation. So our airways, they don't just sit there and conduct air. Sometimes they'll narrow and sometimes they'll widen depending on the circumstances. And for some people, they may have difficulty inhaling or exhaling during exercise because their airways narrow, and that can make it a lot more difficult to do things like cycle or run or what have you. So how do we overcome these various factors? I'll talk about that in a second, but the point I'm really trying to make here is that none of these factors will prevent somebody from exercise. They'll just make it slightly harder. So if breathing during exercise can be difficult, what can we do about it? I'll provide you with a few things that hopefully will be beneficial or that you'll learn from. So exercise training, so think of regular aerobic training, will typically lower the ventilatory demand of exercise if you think of it at comparable intensities. So think of somebody who's running at 10 kilometers per hour before or after they've done several weeks of aerobic training. It'll be much easier for them to do that exercise after several weeks of training, partly because they'll be breathing less air. They're a little bit more efficient. So exercise training in and of itself will make it easier to breathe as long as you're exercising at the same intensity. Now, the respiratory muscles, I've talked to you a lot about how they have to work really hard in order for us to breathe. you can actually strengthen them. They're muscles like any others. So there are fairly inexpensive respiratory muscle training devices that add a resistance to breathing and, if done properly, can improve the strength and endurance of the respiratory muscles. And there's evidence that this improves exercise capacity and that it improves the sensations of breathlessness that people sometimes feel when they exercise. And finally, breathlessness is, again, a symptom that's all too common, and it's something that a lot of people have a difficult time with. So doing physical activity or doing activities of daily living can be really difficult if you're feeling short of breath the whole time. And so those with higher cardiorespiratory fitness, they don't necessarily feel that as often, but those with low cardiorespiratory fitness do. So that implies that if you're able to train regularly and improve your cardiorespiratory fitness, that the burden of breathlessness gets lowered. Finally, you can use creative ways like a fan, for example, if you're exercising indoors. Blowing a fan onto your body, specifically close to your face, can reduce sensations of breathlessness acutely in those who feel it when they exercise. And finally, for those who experience airflow limitation or that feel short of breath due to their airways narrowing while they exercise, this can be caused by external factors. And one example of that is the weather. Not so much this year because it's quite warm outside relative to other years, but when it's really, really chilly, cold and dry air can sometimes trigger a narrowing of the airways that make it a lot more difficult to exercise. So avoiding these conditions, maybe exercising indoors where it's more hot and humid, can alleviate some of these symptoms if they occur, depending on the individual. So the last take-home point that I want to really hammer home is, despite all of these factors that influence our ability to exercise, I hope I've convinced you that the lungs are really built for exercise. In fact, they're overbuilt for exercise. Even in adults that are older or those that have chronic respiratory disease, it's quite rare that the lungs are the weak link in our ability to move or to be more physically active. So with that, I'll end it here. I've listed my email address here, so please feel free to contact me directly if you've got questions. I'll sit around for as long as you need me to and answer questions from the audience. But I do want to acknowledge my students whose names are listed here, and some of them are pictured here on the right. They do most of the work, so I really should acknowledge all of their hard work and dedication. My collaborators, as well as funding sources that provide money for me to do the research that I do in my lab at the University of Winnipeg. So with that, I'll stop sharing my screen and I will open the floor for questions if you have anything you'd like to ask.
Feel free to put your video on and ask the question out loud as well. You can put it in the chat, but there's a couple different options. It was nice to see that picture of your students because I know a couple of them are certified fitness leaders with us as well. So that's awesome. Okay, I know there was a question here. I think one of them may have already been answered. Can you improve your respiratory system by exercising your respiratory muscles? I think you've answered that one already.
Yeah, it's just to add a bit more clarification there. It's something that's really, really quite easy to do, and it doesn't take much work. People often think of respiratory muscle training as something that would take as much time as going to the gym, like doing a full body workout, but it's really not actually that time consuming. The normal protocol would be to figure out what your respiratory muscle strength is, and then do the respiratory muscle training on a small device, and it would take about 30 breaths. One set of 30 breaths twice a day, 5 days a week for about 5 weeks to see improvements. So it's actually something that you can add on to your normal respiratory muscle or your normal exercise training regimen with relative ease.
I definitely think that's something that a lot of us have not thought of with regards to exercising. We have another question here. From an evolutionary perspective, why are our lungs overbuilt for exercising?
It's a really good question, and I'd love to give you kind of a definitive answer. The short answer is I don't really know, but what I think is the answer to the question, and I think there's some evidence, some sort of indirect evidence to support this, is that because it's the first step in the transport of oxygen from the atmosphere to the insides of our bodies, it tends to be the one that's probably the most over-engineered. If it was the weak link, then it would be, I think it would have been selectively eliminated from an evolutionary standpoint. So they're really overbuilt so that, the adaptations that occur downstream are the ones that usually stop us from exercising. And it's an organ system that's very thrifty. It does its job really, really well in comparison to others at a fairly minimal energetic cost, even though it can get quite high while we exercise. But that's a really excellent question that I'd love to get a definitive answer about myself.
Excellent. Does anyone have any further questions before we sign off for the evening?
Mm,
Some
I
fire.
actually have one thing I want to share. As someone that has asthma, I cannot do stuff like sprinting in grass because there's pollen or
Absolutely.
places that are super smoky. It triggers a serious asthma attack. But one the tactic I want to share is a good way to reduce your odds of starting wheezing, having the symptoms of asthma is breathe in the nose and out the nose while you're exercising.
Yeah, absolutely. That's a very great point. And yeah, it comes down to conditioning air. Our airways don't like irritants, like you're talking about grass clippings and things like that.
Mhm.
And they don't like cold and dry air. It really needs to be warm and humid. And so just to piggyback on that comment, there's a famous runner in the US, Galen Rupp. And in 2010, he ran the 10K US Olympic trials, and he wore a mask, and it was the first time that anybody had seen somebody wear a mask. This was way before the COVID-19 pandemic, obviously, but he was doing it because his asthma would get triggered in these very dry conditions. And so it happened to be in a dry climate, the race. And so he put a mask on and it kept the air from getting too dry. It stayed fairly moist, and he won the 10K US championships that year with a mask on. So I'm not necessarily advocating for that. I'm just saying that finding ways to condition air and avoid some of those irritants, whether it be dry air, grass clippings, or whatever, or breathing through your nose, whatever is easiest to alleviate those symptoms is definitely the way to go. So thanks for bringing that
Mhm.
up.
Yeah.
Another question here. I see, what device would help train the lungs?
Yeah, so there's a lot of different devices. It could be anything that adds a resistance. There's some that are a lot fancier that allow you to really tailor the resistance individually to the person. But you could use a straw, essentially. Anything that would make it harder to breathe would be an efficient way to add a load onto the respiratory system. If you Google a company called Power Breathe, they have a range of them that are quite popular, but essentially anything that adds resistance to breathing will do the job. And if you're interested, you can contact me directly, and I can give you a sense of what a normal training protocol would look like for somebody who's interested in doing that.
Okay, another question here. Thank you for that. We all have straws at home somewhere. Maybe not the
Don't
paper
do the
ones.
straw thing. I'm exaggerating for effect again.
What are your thoughts on nasal versus mouth breathing in terms of absorbing oxygen?
Great question. So obviously we have two orifices that we would use to breathe. Typically, when the ventilation is low, we breathe through our nose, and then reflexively, when ventilation is high, we breathe through our mouths. I don't want to get into the sleep thing, because that's a completely separate can of worms. But in terms of exercise, that transition is something that is good. So it reduces the resistance to of airflow through the respiratory system if you breathe through your mouth versus through your nose. And really, from an oxygen transport standpoint, there's not really going to be a huge effect, but it'll be a lot harder to breathe through your nose versus through your mouth. Now, I will acknowledge that's a bit of an oversimplification because the upper airway is pretty complicated, and for some people, it might be easier to breathe through the nose than through the mouth. But generally speaking, when we're at low ventilations, breathing through the nose is preferable, but at higher ventilations, so higher intensities of exercise, we naturally will tend to breathe through our mouths.
Okay, another question here. What about a high altitude mask? It is basically a good and convenient shortcut to hiking up a mountain.
Yeah, those altitude masks, they're actually a great way to train your respiratory muscles. So they're a simple way of adding a resistance to breathing that'll strengthen those respiratory muscles. In terms of simulating altitude, it's closer to a respiratory muscle trainer than it is to altitude, just because it doesn't necessarily lower the partial pressure of oxygen, which is what happens when we go up to high levels. But they're very effective as respiratory muscle trainers, absolutely, and commercially available, and you can buy them. So it's a fairly easy tool to use.
Okay, great. Getting a lot of great questions here.
Yeah,
Is there a way to cool the body by breathing in a different way?
that's a great question. So there's some debate about this in the scientific literature. I have a dog at home, and I run with him quite frequently. And when we're both running, obviously we're both breathing lots, but he breathes a lot more than I do, and that's because dogs have a plexus, a dense vasculature right above their palate, and they use that to thermoregulate. So they cool their bodies actively by breathing. Humans, not so much. We definitely do lose heat through our respiratory system, and the more we breathe and the colder the air we breathe, the more we'll cool our bodies down. But generally, again, the main goal of moving air into and out of our lungs is gas exchange, not thermoregulation. But I would imagine, any situation where you're breathing in air that's cool, or cooler air as opposed to warmer air, like if you're exercising indoors and you're reducing the air temperature, that'll have a substantial impact on how much heat you're dissipating from your body, specifically through your respiratory system.
Okay, and one other question came in by text. Mask use does not inhibit much airflow. So I think what they were trying to say is that when we were all going through the COVID-19 pandemic, a lot of people were wearing masks, and there was a lot of research out there saying it's not inhibiting your airflow. It's just a barrier in front of your face. So do you agree with that analogy as well?
Yeah, so especially early on at the beginning of the pandemic, when there were closures to fitness facilities and things like that, myself and a few of my colleagues, a mixture of physicians and scientists in Canada and the US, we wrote a paper on exactly this point that's freely available. I can send the link if you're interested. And it's fairly digestible. But the Coles notes is that there's a lot of research that's been done in occupational settings for N95 masks. And as long as they're worn properly, which is really the big important bit there, they don't actually have a substantial physiological impact, even when you're exercising pretty intensely. But I think a lot of people weren't used to wearing masks properly when they exercised. And I know myself, especially early on, I would wear a mask too long and it would become saturated with water and then kind of collapse on my face. And that can have a negative impact. But as long as you're using a new masks and cycling them quite frequently, or if they're reusable, ensuring that they don't get saturated with water, there's not a lot of evidence that proper mask use will have a detrimental impact on exercise performance or physiological function while exercising, with the exception of breathlessness. It is kind of an uncomfortable thing to have something constricting on your face. It won't stop you from exercising. It'll just make it less comfortable to have a humid, hot kind of bag around your face while you're exercising. So, yeah.
That does not sound amazing, does it?
No.
Yes, if you could send me that, and then anyone who's on the call that's interested in receiving that paper as well.
Yep.
I think unless there are more questions, I think that we're going to end it off here for tonight. This has been a wonderful presentation. I think we've all learned a lot. Some of us are probably going to need a little bit of time to kind of digest the information and kind of come back to you with more questions. One more quick question here we have. Does practicing the various yoga breath techniques assist with conditioning respiratory muscles?
Yeah, of course. So there are some studies on kind of yogic breathing, and definitely there's any sort of work that your respiratory muscles are doing over and above what they're doing normally is a way of training them. So again, fit people that exercise a lot, they're going to have stronger respiratory muscles than people who don't. And that doesn't necessarily have to be aerobic exercise. It can be yoga. It can be anything where you're thinking about your breathing and applying a bit of resistance to airflow into and out of your lungs. So definitely, for sure.
I just want to say again, thank you so much for giving us this presentation and all of this wonderful information. I think breathing is something we thought about, but maybe didn't realize some of the nuances that were different between as we age and different genders and that sort of thing. So thank you so much.
My pleasure.
And
Thanks for having me.
take care.
Okay, take care. Thanks, everyone.